humanistic, everything, actually everything I've ever learned. I do come from an addiction type family systems. And I usually view the client that came in from probably a family where there's dysfunction. And I want to identify, what does this client need right now? What's their most urgent need?
Primarily cognitive behavioral therapy. That's the most accessible, I think, for most people in terms of, changing behavior, looking at behavioral change, understanding what they're doing, why it's not working so well, or identifying that, coming to identify that, and then in turn attempting to revamp behaviors to improve functioning and to do better in the world. But I'm also, I use some transactional analysis around relationships, reality therapy. Systems is a huge piece of what I do, because I don't look at any individual as an individual. I look at them as a part of a system in which they exist. And I mean, that's, to me, the only way. I never look at an adolescent. I mean, you can talk about an identified patient, but it's really a family, and sometimes, far beyond that. Certainly culture. It's a whole nother piece.
Treatment modalities.
The majority of the work that I do is one-on-one individual sessions. I do groups of women. I have done some family sessions. I think the family sessions are the most challenging. They provide a counselor or therapist a lot of information when you see the interactions. I think people are more honest in individual sessions, so I usually try to do a combination. A lot of people aren't ready for group, and they really don't want to reveal themselves, share their pain, their shame, or whatever among other people. So it may take some time for an individual to gradually get prepared for that. But actually sharing in a group setting is probably the most beneficial, and most of the women that I work with are involved with 12-step work or other types of support, self-help, women helping women. The benefits are substantial.
Well, initially, I think one of the strategies that I use is confrontation. They are people that don't expect a counselor to confront them with what they're doing. So we work on finding out why, the need for it, and we look at history. We look at when they were children, what happened. We work through the maturational cycle to see why they came to the point, because some people begin using drugs at 9 or 10, others begin at 26. So you want to know what was the impetus that caused them to begin at different ages in their lives, or different stages, life stages. So I work with them with regard to that, and I work with each person, even in a group. I know them individually, I know their case files, and I almost make it an individual group process. And I think that's what creates a level of success.
Certainly in terms of understanding, and transactional analysis really incorporates, Freudian models of ego, superego, and id. So it uses them, and it I think communicates better to most people. In terms of understanding how they are communicating with whom, the things that push their buttons, why, and then threading that back through time and space to childhood, to, for adolescents, of course, childhood isn't that far away, but to relationships with parents. So, starting to identify those threads and issues and then helping them, having the raised consciousness then in turn deal with them and deal with their situations. Reality therapy, I mean, people really, I have found, are enormously influenced by their milieu, by their family, by a single person. And they have a lot of issue with distortions at that point. So when they come into you, they're really wondering if they're losing their minds. Wait a minute, I think that, they have a lot of cognitive dissonance. So just a lot of internal, activity and turmoil, trying to figure out, like, is that the reality, what he told me it is, or what she said, or what they're telling me, or, like, how come I'm so confused by all this? So we do a lot of sorting out with that, and reality, people need a lot of support, and that's, I didn't even write that down, which I should have. The heart of everything you're doing is about the supportive relationship. It's only within that that you build the trust that somebody can say to you, wait a minute, is it me or is it them, or can even tell you what their situation is outside of the therapy room, so that you can help them sort out what makes sense and what doesn't, what's real and what is not, and what's in someone else's interest as opposed to what's in theirs. So it really is an important part of what I do.
Working with women.
The majority of the people I work with are women who are in recovery from addiction. And I do group and individual type work with them. There's many substances that these women are affected by, and those create complications in themselves. Most of them are young mothers. Parenting and the ability to get, to treatment, having childcare and all those issues, they're really important for the recovery. And I see the recovery for young women with children to be very complicated.
Self-awareness.